Hello, you're welcome back to my channel. And this week we'll be talking about red eyes. This red eye is something that is common in our society, and we name it a lot of things, ranging from Apollo to some people go as far as saying is diabolic. So today I want to be addressing this issue of red eyes and what can cause these red eyes. We will be looking at what exactly is this red eyes, what are the causes, and then how do you manage it, or how do you get rid of these red eyes, because it's not beautiful. I'm your online eye doctor, Ada Eze, and you're welcome back. What is this red eye? This red eye is the redness of this whitish part of the eyes, this white part of the eyes that we normally see. Yeah, and it's called the sclera. We call it the sclera. So the redness of this part, the redness can be mild, it can be very red, or it can be like a patch, like just one place you just see a red patch there. Then that redness is actually caused by the dilating of the tiny blood vessels, which is between this whitish part of the eyes that we see. There is another transparent covering known as the conjunctiva. It's transparent, like waterproof, like, so we don't actually notice it. So this conjunctiva, there are tiny blood vessels that we don't know that are there. So anything that causes these blood vessels to dilate, anything that causes these blood vessels to dilate can give you a red eyes. So what are the things that can cause that tiny blood vessels that are just there to help support and send nutrients to eye? What can cause them to dilate? So it can be ranging from environmental factors to your lifestyle to underlying infections, then to the type of medications you might be taking, or you're still taking. Let's now talk about these things in details. So environmental factors can range from dry air. There are some places that have dry and dusty air. So this dry air, they don't help with our eyes. Yes, they can actually lead to dry eyes. And the dry eyes will make you feel like something is in your eye and you constantly rub it, thereby causing these blood vessels there to dilate. Dry air and dust. Then we can also think of chemical pollutants, gaseous pollutants, chemical substances that you expose your eyes to. Like when you're swimming, you expose your eyes to chlorine, and this chlorine can actually cause the blood vessels there to dilate. Is a part of environmental factor that can cause this red eye to occur. Then we talk about smoke. People burn indiscriminately, you see smoke here and there from vehicles, from your generators, from a lot of things. So this smoke can also give you a red eyes. Then there are airborne allergies. You can expose yourself to airborne allergies that can also give you this red eye. That's for the environmental factors. There are a lot of them, but these are the most popular ones within that we experience almost every day that can give us this red eyes. Now, let's talk about your lifestyle that can give you red eyes. There are people that wear contact lens for long. Contact lens is not bad. So, wearing contact lens for a very long time can also give you these red eyes. Then, um, prolonged use of screens. There are people that their daily life, everything revolves around screen. So, this prolonged use of screen can also give you these red eyes. Then insufficient sleep. Some people, they work too hard. Yes, we know we work too hard, but let's just make out time to sleep. This 6 to 8 hours sleep every night is very, very important. So no matter what you do, just try to get at least 6 hours of sleep. So you help your eyes from getting fatigued and then turning red. So sleep very well to reduce redness of the eyes. Then there is also smoking. Some people smoke. Is a lifestyle. In as much as it's hard, you can get help to help you quit smoking. Smoking also causes red eyes, one of the major causes of red eyes. That's it for our lifestyle that can lead us to have red eyes. Then some underlying eye infections that can cause red eyes. It ranges from serious to from mild to very serious eye infections. We know that nothing is mild, but some we can just overlook them. Let's talk about the pink eye, what we call conjunctivitis, commonly called Apollo. Conjunctivitis gives red eye. So when it's conjunctivitis, when it's Apollo, you go see your doctor. Proper eye drops can be given, although it can still wear off on its own. It can still run its course within few days. It will just run its course and then stop. Then there is another condition known as the dry eye. Yeah, the dry eye. Many people experience this dry eye. They might not even know. The dry eye is as a result of insufficient tears or insufficient tear quality. You know, we have quantity and we have quality. Yeah, so it can be insufficient tear quality or insufficient tear quantity. It can cause these red eyes, these dry eyes, and then dry eyes can then lead to red eyes. Then there is inflammation. There are many types of inflammation, things that can cause inflammation. It can be acute sinusitis, and a lot of them, there are many causes of inflammation. If there are eye allergies, things your eyes are allergic to, things your body is allergic to. So you might react to something that you ate and it also gives you pink eyes. Maybe you don't like peanuts and you took peanut butter or something that has peanuts in it. Maybe you're allergic to peanut, not that you don't like peanut, you're allergic to peanuts and you ate peanuts or something that has peanut like peanut butter, and then you start reacting to what you're allergic to. It can also give you the red eye. Another one can be contact lens wear. Contact lens wear, you know, when you're constantly touching your eye, fixing the contact lens and all, you can scratch. Not to scare people using contact lens, you can just actually be careful about it. So you can scratch your eyes and then uh you react to it. Yeah, it's normal. So when you abrase it without knowing, not that you purposely did it, maybe you won't even feel it, but the contact lens that is constantly sliding over your eye can actually cause a little bit of abrasion, then giving you the red eyes. So these are the causes, the common eye conditions that can give you the red eye. Then the serious ones, very serious one that you need to run to the hospital as soon as possible when you notice it, is when you notice a sudden severe pain in your eyes. It can be acute glaucoma. It also gives red eyes. It can be uveitis, and then some that take a longer time to actually become painful or progress to very red eyes, but they're just that they've been there. Things like herpes zoster keratitis, when you start noticing crusting around your eyes, something like blisters around your eyelids, you need to rush to the hospital. Um, Maybe one eye, especially, you need to rush to the hospital and get doctor's attention. Then it can be herpes zoster ophthalmicus, also similar. When you start noticing blisters, not just on your eyelids, but around, like maybe tip of your nose, around one part of your face, you're noticing blisters, like blisters with crusting. You know what I mean by crusting? Like flakes, like something that came there and dried up, like mucus that came and dried up. You noticed it, and the eyes might be painful or just mild pain. You just have to see your doctor as soon as possible. So then other causes can be as a result of trauma. Maybe you were fighting and someone slapped your eye. You can get especially this red patch on the eye. But when you see your doctor, after diagnosis, it may or may not even need any drops to be removed. So when you start noticing red eyes and you see that you can't manage it, please don't go for over the counter um red red eyes removal. Yeah, there's something like that. Red eye remover eye drops, vasoconstrictors that actually help remove the redness of the eyes. So it will help, but it will just remove the redness without treating the underlying condition. If there are underlying conditions to this redness, the um, eye drop remover will just remove the redness without handling the underlying condition. What actually caused this redness? It won't handle it. It will just remove it, and it will still be there, disturbing, and might even become more fatal the next time it will show up. So you don't go for over the counter red eye removal eye drops. You don't do it. And another thing that should make you not to do it is you might become addicted to it. Yes, that it will clear it, but after some times the redness will come, especially when you've not treated the underlying eye condition. It will come back and you still use it, it will go and it still come back again. And at a time, without that red eye, without the eye drop that removes this eye redness, without it your eye will always look red or seem red. So that's why we advise that whenever you notice any redness that you don't know, especially if it's painful, it you notice blisters, you notice crossing, this crossing like flakes, I mean, and you notice that you can't stand it, it's severe, then you notice it comes with blood vision, like your vision is decreased, is not as it used to be, then you need to rush and see your doctor. Because most at times these things you won't know, you might think normal pain relief can handle it, red eye drop remover can handle it, but then herpes zoster ophthalmicus, herpes zoster keratitis, corneal ulcer, they end up leaving a permanent damage when not handled well, especially from the start. They might end up leaving you blind on that eye affected, or even on the both eyes, who knows. So that's why we beg that you rush and see the doctor whenever you notice any of these irregularities in your eyes. When we talk about medications, we talk about antihypertensive medications that some people take. It can lead to dry eye, which will induce this redness of the eyes. Thank you for joining me in this episode. Hope you enjoyed today's video on red eyes. Hope you got value too. Subscribe so that you don't miss out on our weekly videos on Wednesdays by 8 p.m. And also turn on the notification bell so you always be with me, and let's work together on how to get our best vision ever. For more information, you can always drop a comment. I will surely answer. Or you can go to my email and drop a message. Thank you and stay safe. Take care of your eyes too. Bye.